In Chapter 9, we discussed wounds, and in Chapter 10, we're going to learn how to bandage them. There are many different types of wounds that require different types of dressings. A dressing covers the open wound, and it should be sterile, larger than the wound, thick, soft, and compressible, and free of lint. You don't want any of those little pieces of lint getting into the wound. The purpose is to control bleeding, prevent infection and contamination, also to absorb blood and any fluids and protect the wound. There are different types of dressing. Gauze pads for small wounds, adhesive bandages for small cuts and abrasions, and trauma dressings that are large, thick, and absorbent. Improvised dressings, if you have none of the above, should be clean, absorbent, soft, and free of lint. When you're applying a sterile dressing, wash your hands and wear exam gloves. Use dressings that are large enough to extend beyond the wound. Hold the dressing in one corner and place it over the wound and cover with a bandage. Bandages should be clean, but they do not need to be sterile. They're used to hold the dressing in place, apply direct pressure, prevent or reduce swelling, and provide support for an extremity or joint. Bandages, again, what you want to look at is if they're too tight, you will notice that there's a blue tinge or on the fingernails or toenails, or blue or pale skin color. There might be tingling, coldness, inability to move the fingers or toes, or you can feel a pulse before you bandage but not after. Types of bandages include roller bandages that come in different widths and lengths and types of material. There are self-adhering, conforming bandages that are elastic or gauze-like. There are gauze rollers. They're non-elastic cotton. Then there's also elastic roller bandages that provide compression. There are triangular bandages such as slings and cravats, adhesive tape, and bandages. If you're applying a cravat bandage to the head, place the middle of the bandage over the dressing and wrap around the head. Cross the two ends snugly and bring ends back around and tie knot. As we go through these types of bandages and how to apply them, make sure you are looking at the pictures so that you can see how this is done, and any other material that's supplied in this chapter that would help you understand how to apply bandages. If you are applying a cravat bandage to the arm or leg, wrap the center of the bandage over the dressing. Turn one end going up the extremity, the other going down. Tie bandage off over the dressing. For the palm of the hand, fill the palm with bulky dressing or pad and close fingers. Wrap one end around the fingers, the other around the wrist. Wrap the bandage crossing over the fingers and around the wrist, and then tie the bandage off at the wrist. If you're using a roller bandage and we're using the spiral method, start at the narrow part of the arm or leg and wrap upward. Make 2 straight anchoring turns. Make overlapping crisscross turns, and then finish with 2 straight turns and secure. You can use a figure 8 method for elbow or knee. Make 2 straight turns over a joint. Make 1 turn above the joint, overlap the first turn. Make 1 turn below the joint, overlap first straight turn, and continue alternating turns. Finish with 2 straight turns to secure end. There's a figure 8 method for the hand. Make 2 straight turns around the palm, carry bandage diagonally across back of hand, around wrist, and back across palm. Make several figure 8 turns overlapping each, finish with 2 straight turns around the wrist and secure the end. For the ankle, make 2 straight turns around the instep, make the figure 8 turn across the front of the foot, around the ankle, and under the arch. Make several figure 8 turns overlapping each turn, and advance up the leg. Finish with 2 straight turns around the leg and secure the end. You can secure a roller bandage using adhesive tape, safety pins, or clips that come with the bandage. There's a loop method of securing bandages, and you loop tape around the thumb or finger and work backward. Encircle the body part with the looped and free ends and tie together. There's a split tail method of securing bandages. You split the end of the bandage lengthwise, not to prevent further splitting. Then you wrap ends in opposite directions around the body part and tie together. You can apply adhesive bandages by removing the wrapping and hold by the protective strips. Peel back protective strips and place on wound. Pull away protective strips and press ends down to secure. So that is a brief overview of how to apply bandages. But again, unless you're actually practicing them, it's hard to just learn by listening and reading. So if whatever materials come with this chapter, any other ancillary materials, make sure you're using them so that you understand how to apply, and try practicing this on your own. Take each one of these type of bandages and try practicing them on someone else so you get some experience doing it.